Mental health services in Queensland and across Australia rely upon legislation like the Queensland Mental Health Act 2016. This and other state mental health legislation specifically allows for restrictive practices including seclusion, physical and mechanical restraint, forced feeding and forced medication. If a patient does not comply or demonstrates distress or psychological decline upon experiencing these practices, these responses are typically used by clinicians to demonstrate why the patient cannot be treated voluntarily and needs to be continued to be held under the Mental Health Act. Even though research has found that those practices cause that harm. At the same time, Queensland Health and other state-based health and mental health services rely upon documents like the Australian Charter for Healthcare Rights, which states all patients have the right to safety, respect, partnership, information, privacy, and feedback, which are all things patients are denied when they're held under the Mental Health Act. Patients under the Mental Health Act are not entitled to a lawyer for representation at tribunals, even though they're specifically labelled unable to make decisions regarding their care. In Queensland, even if a patient is able to obtain a lawyer, which they will have to pay for, less than 1% of patients are successful in having a treatment order lifted if the doctor is arguing to maintain it. At one of my tribunals, I argued in line with the legislation and spoke of the organ damage I was experiencing from negligence by the doctors responsible for my care. I also put this in writing. The two registrar psychiatrists arguing against me weren't doing a very good job, and so the tribunal members offered for them to get a senior psychiatrist in the room, or they were likely to lift the order in my favour. When the senior psychiatrist came in and I continued arguing my case well, the most senior tribunal member ended the meeting, saying that we didn't have time for this, and maintained the order against me. Not long after this, the senior psychiatrist wrote that I should be discharged from the hospital because of how traumatizing the admission had been, and that there was no way to rectify this and have positive outcomes. Even though I was under the Mental Health Act, I never received medical care from the Public Health Service for the damage I'd sustained to my internal organs from the harm they had done. I was forced to get that care through the private system 5 years later, still unable to work or study because of how severe my condition was. The World Health Organization and World Psychiatric Association identify legislation like the Mental Health Act 2016 as inherently coercive, reinforcing power imbalances between patients and staff and oppositional to the values of equality, dignity, and respect, which the Australian Healthcare Charter states all patients have a right to. Yet the Hospital Health Service and Office of the Health Ombudsman see no issue in what I have experienced while under the Mental Health Act 6 years ago and continued to experience for the 6 years after being free from the involuntary treatment order, where my historical mental health status was used to deny me medical care for the damage I had sustained. Evidence provided in recordings and photos were not referred to for decision-making by the Office of the Health Ombudsman. Only the hospital records was relied upon, as confirmed to me by the Office of the Health Ombudsman. There has still been no accountability from the Public Health Service for my case, and I still can't access the Public Health Service for healthcare and receive that in a safe way that meets my needs. People still ask, what alternative was there? What other options were there than to treat me like this? The other options were to treat me with dignity and respect, to believe me when I stated what I needed, what my medical history demonstrated my body required to complete basic functions, and to adopt trauma-informed approaches to care, which were and still are my rights under the Australian Charter for Healthcare Rights. In 2019, the World Health Organization published a collection of materials for training, guidance, and transformation called QualityRights, to support clinicians and all people to end coercive approaches to mental health care. When implemented, those approaches have better outcomes for patients and clinicians, while also reducing cost burden of service provision. That means less burnout for staff, lower costs for services, and less traumatic and disabling experiences for patients. So what do we do? The alternatives to coercive practices to healthcare are right in front of us. As found in the investigation into Stephen Kelly's death at Robina Public Hospital, sometimes the alternatives are spoken directly to clinicians by family members, carers, and support workers. They're just ignored. We need clinicians to actually engage in those alternatives, and our systems of accountability, like the hospital health services themselves, the Office of the Health Ombudsman, and AHPRA, to act when patients, clinicians, and politicians report these things happening. Thanks.